What is the core principle behind positive reinforcement techniques in animal training, and how does it differ from negative reinforcement? Explain the implications of using positive reinforcement for long-term behavior change in animals. Answer: positive reinforcement is based on rewarding a desired behavior to increase the likelihood that the behavior will be repeated. The core principle is that by providing a positive stimulus, such as treats or praise, immediately after the correct behavior, the animal is motivated to repeat the action. Difference from negative reinforcement. Positive reinforcement involves adding a pleasant stimulus to encourage behavior, e.g., giving a treat after the animal sits on command. Negative reinforcement involves removing an unpleasant stimulus to encourage behavior, e.g., stopping an electric shock when a horse stops pulling on the reins. Implications for long-term behavior change. Positive reinforcement is effective for promoting long-term behavior because it fosters a positive association with the desired behavior. Over time, the animal learns to perform the behavior in anticipation of a reward. It also improves the relationship between the animal and the trainer, which can enhance trust and communication. However, it is important to ensure that the reward is consistent and appropriately timed, as delayed or inconsistent rewards can confuse the animal and slow learning. How would you modify an obedience training protocol for a dog that has shown signs of fear-based aggression towards strangers, and what specific behavioral modification strategies would you incorporate to address this issue effectively? Answer: when dealing with fear-based aggression in dogs, it is crucial to approach the situation with patience and a structured, progressive training protocol. The goal is to desensitize the dog to the stimuli causing the aggression. Strangers encounter condition its response. Steps in modifying the protocol. Desensitization. Gradually expose the dog to strangers at a distance where it does not exhibit aggression. Over time, decrease the distance between the dog and the strangers, ensuring that the dog remains calm before advancing further. Counter-conditioning. Pair the presence of a stranger with something positive, such as treats or toys, to change the dog's emotional response to the stranger from fear to positive anticipation. Positive reinforcement. Reward calm behavior during each encounter with a stranger. Gradually increase the level of difficulty, e.g., having the stranger move closer or speak to the dog. Avoidance of punishment. Punishing fear-based aggression can increase anxiety and make the problem worse. Focus on rewarding the desired calm behavior instead. Behavioral modification tools. Click training can be used to mark calm behaviors in the presence of a stranger, ensuring the dog knows exactly which behavior is being reinforced. Muzzle training in case of extreme aggression may be necessary for safety during training, but it should be used only as a temporary tool. Mr. Smith, a horse trainer, is working with a horse that has a history of nervous behavior around riders. Despite using positive reinforcement techniques, the horse continues to resist being saddled. Mr. Smith has been reinforcing calm behavior but wonders whether he should adjust his training strategy to achieve better results. What factors should Mr. Smith consider in modifying his approach, and what additional steps might be necessary to address the horse's anxiety? Answer: Mr. Smith should first assess the underlying causes of the horse's anxiety to ensure he is addressing the root of the problem. The following factors should be considered in adjusting his approach: understanding the horse's learning pattern. Horses are sensitive to changes in their environment and can develop specific learning patterns based on prior experiences. Mr. Smith should evaluate if the horse associates saddling with discomfort or fear from past experiences. Adjusting the timing of positive reinforcement. Reinforcement must occur immediately after the desired behavior to help the horse associate the calmness with the reward. Introducing gradual desensitization. The horse might need a gradual approach to being saddled. Use of relaxation techniques. Relaxation techniques such as gentle massage or allowing the horse to move freely in a safe enclosed space can help reduce anxiety. Working with a professional veterinarian or behaviorist. If the anxiety persists, Mr. Smith may need to consult a veterinarian to rule out any physical discomfort or consult a behaviorist for a more specialized approach. How can an animal care professional effectively communicate with a client who is dissatisfied with the progress of their pet's training, especially when the client expects quick results? Answer: effective communication in this scenario requires empathy, clear expectations, and educating the client about the training process. Empathy and active listening. Begin by acknowledging the client's concerns and frustration. Use phrases like "I understand your concern" or "I can see that you're disappointed with the progress so far." Setting realistic expectations. Explain that animal training is a process that takes time as animals learn at different paces. Educate the client on the natural progression of training, reinforcing that consistency and patience are key. It's important to convey that certain behaviors take longer to correct, particularly if they are deeply ingrained or tied to emotional or behavioral issues, e.g., anxiety or fear. Providing progress reports. Offer regular updates on the pet's progress and suggest concrete steps to demonstrate improvements. This may involve showing the client examples of the pet's progress or introducing them to intermediate milestones. Encouraging patience and commitment. Reinforce the importance of long-term commitment and consistency in following through with the training protocol. Offering small but achievable goals can keep the client motivated. Offering solutions. If the current training plan isn't effective, suggest alternative methods, such as seeking a second opinion from a behaviorist or adjusting the approach to better suit the pet's individual learning style. In what situations is clicker training considered the most effective tool for animal behavior modification, and what are some limitations of relying solely on this method? Answer: clicker training is highly effective in scenarios where precise timing of reinforcement is crucial. It is particularly useful in the following cases: complex behaviors. Clicker training is excellent for teaching animals complex behaviors or sequences of actions because it allows for precise marking of the exact moment the animal performs the desired behavior. Positive reinforcement. It provides clear feedback to the animal that the behavior is correct, which strengthens the behavior. It can also be paired with treats or other rewards to encourage desired actions. Improved animal handler communication. The click sound is consistent and easily recognizable by animals, which helps eliminate confusion about what is being reinforced. Limitations. Dependency on the clicker. Over-reliance on the clicker can lead to the animal associating the behavior with the sound rather than with the reward itself. It is essential to gradually phase out the clicker and rely more on verbal cues or other reinforcement methods. Requires consistent use. For clicker training to be effective, it requires the trainer to be consistent with both the timing of the click and the reward. Inconsistent use can confuse the animal, leading to slower or failed learning. Not effective for all types of behavior. Clicker training is not effective for all animals or for all types of behavior. For example, in cases of aggressive or fearful behavior, other methods such as desensitization and counter-conditioning may be more appropriate. How does the training protocol for a dog differ from that of a horse when preparing for public performances, and what factors must be considered for each species in terms of mental and physical preparation? Answer: training a dog and a horse for public performances requires different protocols due to their differing psychological, physiological, and behavioral needs. Dogs. Socialization. Dogs need to be exposed to different environments, sounds, and people before performing in public. Positive reinforcement can help dogs remain calm and focused during performances. Shorter training sessions. Dogs often have shorter attention spans, so training sessions should be brief but frequent. Mental stimulation. Dogs benefit from varied training exercises that keep them engaged and prevent boredom. Horses. Desensitization to environment. Horses need to be desensitized to large crowds, loud noises, and unexpected movements to perform well in public settings. Gradual exposure to similar environments helps prepare them mentally. Physical preparation. Horses also require conditioning and physical fitness to perform tasks like jumping or trotting in a show. Trust and bonding. Building trust between the trainer and the horse is essential. Horses rely on their rider's confidence and clarity during public performances. Both animals require mental and physical preparation tailored to their species-specific needs, but dogs tend to benefit more from short, repetitive training, while horses need longer training periods and more gradual exposure to public settings. What strategies should an animal care professional employ when resolving conflicts between pet owners who disagree on how to care for their pet, particularly when one owner is adamant about using a non-conventional treatment? Answer: in this situation, the animal care professional must maintain professionalism, balance empathy with clear communication, and ensure that the pet's welfare is the priority. Active listening and empathy. Begin by listening to both owners without judgment. Acknowledge their concerns and frustrations. Show empathy for their individual perspectives while explaining that the primary goal is the welfare of the pet. Educating the owners. Provide factual information about the benefits and risks of both conventional and non-conventional treatments, ideally backed by scientific evidence. If the non-conventional treatment is unproven or potentially harmful, explain the rationale behind using established methods and ensure the owners understand the possible consequences of their choice. Finding common ground. If possible, suggest compromises, such as gradually introducing certain non-conventional practices alongside conventional care, ensuring the pet's health and safety are not jeopardized. Clarifying legal and ethical responsibilities. Ensure both owners are aware of their legal and ethical responsibilities for the animal's welfare. If necessary, remind them of local regulations or guidelines regarding pet care. What are the key elements an animal care professional should include when educating a pet owner about a dog's dietary needs, and how can they ensure the owner understands the importance of appropriate nutrition for the dog's long-term health? Answer: when educating a pet owner about a dog's dietary needs, the following key elements should be included. Nutritional components. Explain the essential nutrients required in a dog's diet: proteins, carbohydrates, fats, vitamins, and minerals. Emphasize that each nutrient plays a unique role in the dog's overall health and development. Life stage requirements. Tailor nutritional advice to the dog's life stage: puppy, adult, or senior. Highlight how nutritional needs change as the dog ages and how appropriate food choices can impact long-term health, including joint health, coat condition, and energy levels. Breed-specific considerations. Some breeds have specific dietary needs or predispositions to certain health conditions. Educate the owner on how these factors influence food selection, e.g., large breed puppies needing controlled calcium levels. Portion control and feeding schedule. Discuss portion control to prevent obesity and related health issues. Advise the owner on creating a feeding schedule that suits the dog's age, activity level, and metabolism. Signs of poor nutrition. Teach the owner how to recognize signs of poor nutrition, such as weight gain, poor coat quality, or lethargy, and how these signs can be addressed by modifying the dog's diet. Explain the concept of zoonotic diseases and describe 3 key strategies an animal care professional can implement to minimize the risk of zoonotic disease transmission in an animal care facility. Answer: zoonotic diseases. Zoonotic diseases are illnesses that can be transmitted between animals and humans. Common examples include rabies, ringworm, and leptospirosis. These diseases can spread through direct contact, contaminated surfaces, or vectors like ticks and mosquitoes. Strategies to minimize risk. Hygiene protocols. Implement strict hygiene practices, including regular hand washing, using gloves when handling animals or cleaning their enclosures, and sanitizing surfaces frequently. Provide hand sanitizing stations for staff and visitors. Vaccination and health monitoring. Ensure all animals are vaccinated against diseases as appropriate for their species and region. Regular health checks should be conducted to identify and isolate animals with symptoms of zoonotic illnesses. Education and training. Train staff to recognize symptoms of zoonotic diseases and to handle animals safely. PPE and biosecurity measures. Use personal protective equipment, PPE, like masks, gloves, and gowns when dealing with potentially infectious animals. Establish biosecurity measures such as designated quarantine areas for new or sick animals. A client brings in an elderly dog with severe arthritis and limited mobility. The client is emotionally attached and hesitant to consider euthanasia despite the animal showing signs of chronic pain and a declining quality of life. How should an animal care professional approach this ethical dilemma while prioritizing the dog's welfare? Answer: steps to address the situation. Empathy and understanding. Acknowledge the client's emotional bond with the dog and validate their feelings. Use compassionate language to convey understanding of their concerns, educating on quality of life. Explain the concept of quality of life and discuss objective indicators such as pain, mobility, appetite, and social interaction. Use tools like a quality of life scale to help the client assess the dog's condition, exploring alternatives. Present all possible options, including pain management strategies, physical therapy, or mobility aids, while being transparent about the expected outcomes, providing professional guidance. Gently recommend euthanasia if the dog's suffering is significant and irreversible. Emphasize that this decision prioritizes the dog's well-being and prevents prolonged suffering. Supportive approach. Offer emotional support and resources, such as counseling or support groups for pet loss, to help the client cope with their decision. What are the key ethical considerations when caring for animals from different cultural backgrounds, and how can animal care professionals develop sensitivity to these cultural differences? Answer: cultural attitudes toward animals can vary greatly depending on societal norms, religious beliefs, and historical practices. For example, some cultures view animals as family members and may expect high levels of care and attention, while others may have utilitarian views of animals, seeing them primarily as resources. The ethical dilemma often arises when the expectations of clients or cultural norms conflict with contemporary animal welfare practices. To navigate these cultural differences, animal care professionals must educate themselves on cultural diversity. Understanding the cultural perspectives of clients helps to provide better care while respecting their beliefs. Develop communication skills. Respectful communication is essential in discussing care plans, especially when cultural beliefs may affect the treatment of animals. Balance animal welfare with cultural values. Professionals should explain the ethical obligations of animal welfare and provide alternatives that honor cultural beliefs without compromising animal health. In what ways can animal care professionals ensure they maintain professionalism and adhere to industry standards, and why is ongoing education important for career development? Answer: maintaining professionalism involves upholding ethical standards, showing respect to animals, clients, and colleagues, and consistently demonstrating competence in animal care practices. The industry has various guidelines and codes of conduct, including the Code of Ethics from the Australian Animal Care and Veterinary Association offer that set expectations for behaviour and service delivery. Key ways to maintain professionalism include adhering to ethical guidelines. Following the principles outlined by regulatory bodies ensures that decisions are made in the best interest of animal welfare. Providing high quality care, using the latest research and practices to ensure animals receive the best care. Respecting client confidentiality, treating all client information with privacy and discretion as per Privacy Act 1988, Australia. Effective communication, keeping clear, respectful communication with clients and colleagues. Ongoing education is crucial for career development because it helps professionals stay current. The field of animal care is continuously evolving with new treatments, technologies, and ethical guidelines. It builds specialization. Continuing education opens opportunities for certification in specialized areas such as exotic animal care or behavioral therapy. It enhances employability. Professionals with up-to-date certifications and skills are more likely to be sought after in the job market. Continuing education programs, such as those offered by the RSPCA and Veterinary Technology Associations, provide valuable updates and resources to help professionals stay at the forefront of animal care practices. Sarah is an animal care worker at a local shelter. A new client, Mr. Cooper, has brought in a dog that appears to have been severely neglected. Mr. Cooper claims that the dog is his pet and that he has always treated it well. Upon further investigation, Sarah finds evidence of malnutrition and untreated wounds. How should Sarah proceed in this situation while adhering to ethical and legal standards? Answer: Sarah's first priority should be the welfare of the animal. According to the Animal Welfare Act 2002, Australia, neglect and cruelty to animals are violations of animal welfare law, and Sarah has an ethical responsibility to act in the best interest of the animals' health and safety. Sarah should document the evidence of neglect, thoroughly record the dog's condition, including photographs, veterinary reports, and any other relevant evidence of neglect or abuse. Assess the animal's health. A veterinarian should examine the dog immediately to assess its condition and provide necessary treatment for injuries and malnutrition. Address the legal aspects. Sarah should report the incident to the local authorities or relevant animal protection organizations, such as the RSPCA, which has the authority to investigate cases of suspected abuse and take legal action. Communicate with Mr. Cooper. Sarah should handle the situation delicately, explaining that the dog's condition indicates neglect, which may result in legal consequences. She should be prepared to answer questions about her responsibilities under animal welfare law and offer support in finding solutions for the dog. Why is it important for animal care professionals to balance empathy with professionalism, and how can they maintain this balance in emotionally challenging situations? Answer: balancing empathy with professionalism is crucial in animal care because it ensures that the animal's welfare is prioritized without compromising the quality of service or personal boundaries. Professionals are often required to manage emotionally charged situations, such as dealing with injured animals or grieving owners, and maintaining a professional demeanor allows for effective decision-making. Empathy involves understanding and sharing the feelings of others, which helps build trust and rapport with clients. However, professionalism ensures that the care provided is based on facts and sound judgment rather than emotional responses. To maintain this balance, set boundaries. While empathy is essential, professionals must recognize their limits and not allow emotions to cloud their judgment or affect animal care decisions. Practice self-care. Animal care professionals often face emotionally taxing situations. Taking care of their own mental and emotional health is critical for maintaining professionalism. Use emotional intelligence. Recognizing the emotional needs of clients while guiding them with calm and clear advice helps create a balanced relationship. What role does cultural sensitivity play in dealing with clients from diverse backgrounds, and how should animal care professionals address situations where cultural beliefs conflict with animal welfare best practices? Answer: cultural sensitivity is vital when working with clients from diverse backgrounds because it enables professionals to respect the client's values while ensuring that animal welfare remains a top priority. The way animals are treated can be deeply tied to cultural beliefs, and understanding these differences helps avoid miscommunication and fosters trust. When cultural beliefs conflict with best practices for animal welfare, professionals should educate clients, explain the importance of following evidence-based practices for animal welfare, and the potential risks of not doing so. Find common ground, identify aspects of the treatment that align with the client's values and integrate them into the care plan. Offer alternatives. If a client's belief conflicts with a specific procedure such as vaccination or spaying, offer alternatives that still maintain the animal's health where possible. Respect boundaries. If no middle ground can be found, animal care professionals must prioritize the welfare of the animal and in some cases may need to report concerns to the relevant authorities following ethical and legal obligations. How can animal care professionals ensure that their decisions are based on animal welfare rather than client expectations or financial pressures? Answer: professionals must adhere to a strict ethical framework that prioritizes animal welfare over external pressures. This can be challenging when clients have different expectations or when financial considerations come into play. To ensure decisions are based on welfare, follow ethical guidelines. The RPR's Code of Practice and Animal Welfare Act 2002, Australia, clearly outline the responsibilities of animal care professionals to prioritize animal health and well-being. Use objective measures. Decisions should be based on veterinary recommendations, scientific research, and best practices, not influenced by the client's budget or other external factors. Communicate effectively. Professionals should explain the reasoning behind their recommendations, emphasizing the importance of the animal's well-being and the potential long-term consequences of neglecting treatment. Document decisions. Keeping thorough records of decisions and discussions helps ensure transparency and accountability. What are the key responsibilities of an animal care professional when dealing with an animal that has a known history of behavioral issues, and how should they proceed in treating such an animal? Answer: when handling an animal with a history of behavioral issues, animal care professionals must approach the situation with caution and an understanding of both the animal's past experiences and its current needs. Key responsibilities include conduct a thorough assessment. A detailed evaluation of the animal's behavior and history should be done by a qualified professional such as a veterinarian or an animal behaviorist. Implement a tailored care plan. The care plan should address the animal's specific needs, ensuring safety for both the animal and the handlers. This may involve using positive reinforcement techniques, desensitization, and behavioral modification strategies. Monitor progress. Behavioral issues may require long-term management, so regular follow-ups are essential to track the animal's progress and adjust the care plan accordingly. Safety precautions. Ensuring the safety of both the animal and other individuals is paramount. The professional should be trained in handling animals with behavioral issues and use appropriate equipment when necessary. How do animal care professionals maintain their competence in dealing with complex cases, such as unusual medical conditions in animals? Answer: maintaining competence in complex cases requires a combination of continuous learning, collaboration, and hands-on experience. To ensure competence, engage in ongoing education, attend workshops, seminars, and conferences that focus on emerging medical conditions and treatment strategies. Consult with experts. In challenging cases, collaborating with specialists in fields such as veterinary medicine or animal behavior can provide valuable insights. Leverage research. Stay updated on the latest scientific research to inform treatment decisions for unusual medical conditions or rare species. Document and review cases. Keeping detailed records and reviewing past cases can help identify patterns and improve future care strategies. Professional certification programs and continued accreditation in specialized areas of animal care help maintain high standards of competence. What ethical considerations arise when an animal care professional is asked to perform a procedure that may cause harm to an animal, such as euthanasia or invasive surgery? Answer: euthanasia and invasive procedures are deeply ethical decisions that require careful consideration. Animal care professionals must ensure that any procedure is justified either to alleviate suffering or for the animal's health. Key ethical considerations include justification for the procedure. Is the procedure in the best interest of the animal? The decision to perform euthanasia, for example, should only be made when the animal's suffering is beyond treatment as outlined by the RPR's ethical guidelines. Informed consent. In cases where the owner is involved in decision-making, the professional should ensure the owner fully understands the procedure and its potential outcomes. Professional guidance. Seek advice from colleagues or veterinary specialists when faced with difficult decisions, ensuring all options are explored. In accordance with animal welfare laws and professional ethics, the animal's best interest should always be the top priority. How do professional animal care organizations like the RSPCA contribute to the improvement of industry standards, and what role do animal care professionals play in supporting these efforts? Answer: Professional organizations like the RSPCA play a critical role in setting standards, providing training, and advocating for animal welfare. They establish best practice guidelines, offer certification programs, and raise awareness about important issues in the field. Animal care professionals support these efforts by adhering to guidelines. Following the standards and practices recommended by these organizations helps ensure that care is consistently high quality. Participating in training and development. Attending courses and workshops organized by these bodies helps professionals stay current with the latest trends and technologies. Advocating for animal welfare. Professionals can contribute by educating the public about responsible pet ownership and supporting legislative changes that improve animal welfare. Through collaboration with organizations like the RSPCA, animal care professionals help raise the standards of care and promote a more humane approach to animal management. What are the key principles of animal reproduction, and how do they vary across species in terms of reproductive cycles and care? Answer: Produce offspring. Key principles include mating behaviors, fertilization, gestation, and birth. These vary across species due to differences in hormonal regulation, reproductive organs, and environmental influences. For example, mammals typically have internal fertilization and varying gestation periods where maternal care is often crucial for the survival of the offspring. Reptiles, in contrast, tend to lay eggs with external fertilization and limited parental care. Understanding these principles helps ensure proper care during breeding, pregnancy, and neonatal stages. In terms of reproductive cycles, some species like cats and dogs have estrous cycles that define their fertile periods, while others like cows have a regular heat cycle with clear signs of ovulation. What are the primary considerations in managing an animal breeding program to ensure genetic diversity and health within the population? Answer: A successful breeding program requires careful planning to maintain genetic diversity and avoid inbreeding. Key considerations include genetic health. Regular genetic screening and pedigree analysis help identify and avoid the transmission of hereditary diseases. Selection criteria. Breeders should select animals based on desired traits, but also on genetic health and fitness to avoid genetic bottlenecks. Record keeping. Maintaining detailed breeding records ensures genetic diversity and allows tracking of genetic lines over generations. Outbreeding. Introducing new genetic material into the breeding pool can help maintain diversity and prevent the risks associated with inbreeding depression. Health monitoring. Regular veterinary care and testing for common breeding diseases, e.g., canine brucellosis, are crucial to prevent the spread of infections and ensure the well-being of both adults and offspring. Mrs. Thompson is managing a small farm that breeds sheep for wool production. One of her ewes, named Bella, is about to give birth. Bella's pregnancy has been progressing normally, but she is showing signs of distress in the final stages. Mrs. Thompson has been trained in animal care but is unsure of how to intervene. What steps should she take to ensure Bella's safety and the safety of the lamb? Answer: In this scenario, Mrs. Thompson should take the following steps. Monitor closely. Distress in late pregnancy may indicate complications such as dystocia, difficult birth, which can be caused by the lamb's size, malpresentation, or other factors. Call for veterinary assistance. If Bella is showing signs of prolonged labor, abnormal positioning of the lamb, or failure to progress in the birth process, she should contact a veterinarian immediately. Provide a clean, calm environment. Ensure Bella has a quiet and clean space to deliver away from distractions and stress. Assist if necessary. If the lamb is not emerging within an expected time frame, Mrs. Thompson may need to assist in the delivery. In cases of malpresentation, e.g., breech, she should carefully pull the lamb or help reposition it with proper knowledge and caution to avoid injury. Post-birth care. Once the lamb is born, ensure that it is breathing and immediately able to nurse. Check Bella for any signs of complications such as retained placenta or hemorrhage. What are the essential considerations in neonatal care for animals, and how do these vary across species? Answer: Neonatal care is vital for the survival and healthy development of young animals. Key considerations include Colostrum intake. Immediately after birth, most mammals require colostrum, the first milk, to receive vital antibodies. Failure to do so can lead to disease susceptibility, warmth, and comfort. Neonates cannot regulate their body temperature effectively. Species such as puppies and kittens need to be kept warm, usually through an external heat source. Feeding. Species like calves and lambs require specific milk formula or the mother's milk if available. Some animals, such as reptiles, might not need maternal care but still require temperature and humidity control for proper growth. Health monitoring. Neonates should be observed for signs of infections or birth defects. For instance, newborn kittens might develop upper respiratory infections if not kept in a clean environment. Physical and emotional support. Regular interaction with the mother or a caregiver ensures proper bonding, which is particularly important for social animals like puppies and kittens. How do common reproductive disorders affect animal breeding programs, and what preventive measures can be taken? Answer. Common reproductive disorders include infertility. This can arise from hormonal imbalances, infections, or genetic issues. It can prevent successful breeding and reduce the genetic diversity of the population. Regular veterinary checks, including semen analysis in males and hormonal assessments in females, help identify fertility issues early. Pyometro, a life-threatening infection of the uterus in female animals, most common in unspayed dogs and cats. This condition requires immediate veterinary intervention and can be prevented by spaying or timely medical attention when signs appear. Mastitis, inflammation of the mammary glands, typically in lactating females, can affect the health of the offspring. This can be treated with antibiotics and proper nursing management. Cystic ovarian disease, COD, a common issue in livestock like cattle and pigs. COD can lead to reproductive failure. It can be managed with hormonal treatments or selective breeding practices to eliminate genetic predisposition. What are the key components of animal housing that ensure the health and safety of animals, and what regulations guide these requirements? Answer. Animal housing must meet several critical requirements to ensure animal welfare. Space and enclosure. The size of the housing should accommodate the species' size, movement needs, and behavior. For example, kennels for dogs should allow for free movement and rest without overcrowding. Ventilation. Adequate airflow is essential for preventing respiratory issues and ensuring that odors and harmful gases, e.g. ammonia, are expelled. Lighting. Natural or artificial lighting must simulate the day-night cycle to support animals' biological rhythms. Safety. Housing should be free of hazards such as sharp objects or toxic substances. For example, enclosures for rodents need to be escape-proof to prevent injury or escape. Regulatory guidelines. In many jurisdictions, animal housing must comply with local animal welfare laws, such as the Australian Animal Welfare Standards and Guidelines or the US Animal Welfare Act. These laws specify minimum space requirements, cleanliness, and care standards. Why are temperature, lighting, and ventilation critical in animal housing, and what specific conditions must be maintained for different species? Answer. Temperature. Different species have varying temperature needs. For example, cold-blooded reptiles such as turtles require external heat sources to maintain their body temperature, while mammals like dogs and cats require consistent ambient temperatures to avoid stress and health issues. Lighting. Many species, especially those that are diurnal, rely on natural light cues for their circadian rhythms. Excessive artificial light can disrupt these rhythms and cause stress or reproductive issues. Ventilation. Proper ventilation is crucial for avoiding the buildup of harmful gases and moisture, especially in high-density housing such as poultry farms. Poor ventilation can lead to respiratory problems, particularly in birds. Fresh, clean air is essential for all species' well-being. How does waste management in animal housing impact animal health and welfare, and what practices are considered best for maintaining cleanliness? Answer. Proper waste management is essential for maintaining a clean and healthy environment for animals. Regular cleaning. Fecal matter and urine should be removed regularly from animal enclosures to prevent the spread of disease and parasites. This is especially important in enclosures with rodents or birds. Sanitation. Using disinfectant safe for animals helps prevent the spread of bacterial infections like Salmonella. Waste disposal. Waste should be disposed of in a manner that minimizes environmental impact, such as composting manure from livestock or using it for bioenergy production. Pest control. A clean environment reduces the risk of pests such as flies or rodents, which can carry disease and disrupt animal health. What key factors should be considered when designing and constructing enclosures for different species to ensure their well-being? Answer. When designing enclosures, it is essential to consider the specific needs of the species housed. Key factors include behavioral needs, Enclosures should cater to the natural behaviors of animals, such as climbing structures for cats or digging areas for dogs. Space requirements. Animals need sufficient space to move, rest, and engage in natural behaviors. Overcrowding can lead to stress and aggression, especially in social species like primates. Safety features. The materials used should be safe and durable. For example, metal meshes commonly used for birds to prevent escape while ensuring adequate ventilation. Environmental control. The ability to control temperature, humidity, and lighting is essential, especially for species that require specific environmental conditions, such as amphibians or exotic reptiles. What are the most common health risks associated with poorly maintained animal environments, and how can they be mitigated? Answer: poorly maintained living environments can lead to a variety of health risks, including infections. Damp, unclean environments increase the likelihood of infections like mastitis or respiratory diseases. Regular cleaning and proper waste disposal minimize this risk. Parasites. Poor sanitation can lead to the buildup of parasites like fleas, ticks, and mites. Regular health checks and pest control measures are essential. Injuries. Sharp objects or inadequate enclosures can lead to physical injuries. Proper maintenance and regular inspection of enclosures can prevent such risks. Stress and behavioral issues. Overcrowding, lack of enrichment, or poor environmental conditions can cause behavioral issues such as aggression or self-harm, particularly in species like rodents or cats. Regular enrichment and space allocation are critical to animal welfare.